What's Gucci with the veterans, military? Hey, today we're going to be talking about U.S. Army Ranger School and VA disability claims process. One of the toughest Army training courses, that a soldier can volunteer for. Let's see what kind of VA disability claims y'all can request and build medical evidence for. Let's get into it. So we got issues of the back. Cervical strain, which can yield anywhere from 0 to 40%. Lumbosacral strain, back strain, same thing, as well as for back specifically, a veteran can get anywhere up to 100% depending on the level of ankylosis that they do have in their spine. Outside of that, there's secondary disabilities, arthritis, sciatica, radiculopathy, and both the upper extremities spawning from cervical strain and the lower extremities spawning from low back strain. But let's go into some common issues that veterans and or active duty military can start building medical evidence for that's clearly related to the training in which, soldiers, as well as, some select services who, I know some Marines who've gone to Army Ranger School, but hey, to each his own. But hey, these are some common things that veterans and military can file for when it comes to VA disability claims. And we got one of the first issues going to be osteoarthritis, anywhere from 0 to 30%, depending on your level of issues, your level of severity. And for some reason, the VA does classify this as a cold injury disability, but it's up to you first to go to medical, get diagnosed with this. After that, if you have any severity of issues throughout the years, make sure you maintain medical evidence, continuity of care, especially if you're active duty. I know it's hard. A lot of military, they don't do that because, hey, trying to hold my billet, trying to stay fucking competitive for promotion. However, you still need to go in, get this treatment. You don't necessarily need to go to military doctors. There's always options. If you got TRICARE, go outside base. If you don't have TRICARE, pay out of pocket. Find a doctor that you can go get evaluated throughout the years, wherever you may be PCS to. Locate that doctor that can help you build medical evidence along the way. That's a proactive approach to the VA disability claims process. Yeah, I got a couple of comments. How am I supposed to know this? How am I supposed to go to medical? Blah, 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 blah. When there's a will, there's a way. And when it comes to once a service member has become a veteran, they find that will and a way to get compensation. So y'all should use the same level of thinking when it comes to building it on the front end, whether you're in military or if you're already separated. So moving on from that. Then we got rheumatoid arthritis. Same thing. Yields 20, 40, 60, and 100% for that. So definitely, if it applies to you, make sure you go in, get a diagnosis. And if your level of severity and issues equate to multiple joint arthritis, definitely make sure that you're going in, getting diagnosed, getting treatment for these issues. Because once you separate and you're a veteran now, or maybe you didn't get diagnosed while you were in, you got it now. Have that doctor evaluate where did that disability had its onset. Obviously, not current day. Hopefully you don't have rheumatoid arthritis in your family tree, because that's going to be an issue, especially if it's related to the family. But if not, if it's more than likely it came from this training, U.S. Army Rangers, and possibly the training that you did afterwards in your unit related to Army Ranger type of training. Definitely document it, build the medical evidence. Moving on from there. Various conditions of the elbow. I'm not going to get into real detail with this, but you can get anywhere from 0 to 60% on most issues when it comes to the elbow, when it comes to ankylosis of the elbow, limitation of flexion, limitation of extension, in both elbows as well. So if it applies to you, like I said, build the medical evidence from the beginning so you're not, trying to scramble for this information at the end. Or even if you're already at the end, if you're a veteran right now, you have that training certificate, you have the badge and the completion, everything. Starting from your training, all the way throughout your military time up until veteranhood right now, you definitely got to capture everything with a personal statement. If you didn't go into medical and document these things, it's going to help you in the long run, because it helps establish many issues did you have with your elbow specifically, or your knees? If you went into medical, if you got it, pull it from your service treatment record or STRs, attach it to that claim you plan on filing for your elbow, for your knee, for your hips, for cervical strain, whatever the case may be. Build. You got to build the medical evidence, be organized. If you already have it, pull it, and, hey, refer to fucking cervical evaluation on X day, whatever fuck. So, the more organized you are, the better the VA disability claims process is going to be for you. Moving on from that. Carpal tunnel syndrome. Same thing. VA classifies this as a cold injury disability, anywhere from 10 to 30% for that, depending on your level of pain, numbness, cold sensitivity, as well as other issues related to carpal tunnel syndrome, especially with the locking up of the hands and or fingers, joints, stuff like that. Like I said earlier, various knee conditions. I'm not going to get really specific with this because the CFR 38, it has a lot of knee conditions that can get you anywhere from 0 to 60% on average. There are some outliers that may yield higher, but some of the commonly claimed knee conditions is going to be ankylosis of the knee, limitation of the knee, limitation of extension of the knee. I think I said, limitation of the knee, both in extension and flexion. Instability of the knee, and then the list goes on. So definitely do your homework, get diagnosed, get treatment. X-rays and MRIs are going to be your best bet when it comes to any or majority of these disabilities. Musculoskeletal issues, X-rays and MRIs is going to be your best bet. Mainly MRIs, because it shows both the bone as well as any nerve damage and stuff like that. So, tip for the wise. And lastly, we got cellulitis, skin issues. Anywhere from 20 to 50%, depending on your level of severity. It doesn't really go into details here in the CFR 38, nor does it say it in the M21-1 adjudication manual. But depending on your level of severity, how big those scars are, skin infections, if it's continuous, chronic, pain, all of that gets considered when it comes to establishing that VA disability rating, if that makes sense. But hey, if y'all like this type of content, let your boy know. Just wanted to get on here right quick, introduce a new series that we're going to be talking about, U.S. military. If y'all like this type of content, like, share, subscribe. Comment down below if you have or if you haven't already tried to get service connected for any of these disabilities and or other disabilities and injuries that you have that spawn from your time in U.S. Ranger School, and you've been dealing with it throughout the years. You possibly haven't gone into medical yet, but definitely you need to get this taken care of. You need to get treated, and by all means, above all else, you need to get compensated for the injuries and the disabilities in which you sustained while serving this great nation of America. Until motherfucking next time, y'all know what fucking time it is. Debo out, baby.